In Oriental medicine, we call the male yang and the female Yang is warm and cold. Thus, there are many diseases related to women that are due to coldness in the body. One of them is cold hypersensitivity, where the hands and feet get cold and the joints ache. It is not healthy for a woman to be cold. Even in the middle of summer, a woman who has just given childbirth must take care of her health in a warm room. From a modern medical viewpoint, cold hypersensitivity translates as autonomic ataxia, or imbalance of the autonomic nervous system. According to modern medicine, avoiding excessive physical labor and stress in order to create a regular autonomic nervous rhythm is one method of overcoming hypersensitivity to cold. Today, we will explain cold hypersensitivity as seen through Oriental medicine for those of you who are unfamiliar with it. Cold hypersensitivity comes about when there are disorders in blood circulation and in the autonomous nervous system that control body temperature, digestion, and heartbeat. This cuts off blood supply to parts of the body, thus lowering temperature. According to Oriental medicine, it is caused by too little yang qi or too much qi. The organs that have an effect on the generation of yang qi are the heart, stomach, spleen, and kidneys. There are various areas of the body that can get cold hypersensitivity. It usually occurs in the feet, hands, abdomen, knees, and waist, in that order. Hypersensitivity to cold is unfamiliar to those of us from the West. Could you please enumerate some of the different types of cold hypersensitivity that occur?
The chill is usually referred to as hypersensitivity to coldness, and it is a disease where certain parts of the body are so cold that normal functioning has become impossible. It normally appears in Easterners, and especially in women. The areas usually affected are the hands and feet, knees, waist, and stomach.
The diagnosis of cold hypersensitivity involves a recently developed method called DITI that detects the area and amount of coldness and observes the progress of therapy. It has been recognized by Western medicine, which in the past did not understand the concept of cold hypersensitivity.
These colors express the temperatures of the various parts of the body. The further left the color is, the lower the temperature it represents, and vice versa. If the temperature is extremely low, it is not detected by the machine and appears black, so that contours of the feet cannot be seen.
The main method of treatment is acupuncture. The acupuncture points vary according to the different causes and symptoms of the disease. To treat cold hypersensitivity in the foot, we concentrate on the acupuncture points that will help qi and blood circulation. The acupuncture points are the sul-an-hyul on each side of the knee, the chok-samri-hyul, the samun-gyo-hyul, which controls the menstrual functions, and the taechung-hyul, which is located on the upper part of the big toe.
So when the stomach is cold, we focus on the junghan-hyul, which is in the middle of the stomach, and apply acupuncture to the points to each side of the navel and in the abdomen. We also make use of acupuncture points on the arm, such as the gok-ji-hyul, which controls qi circulation, the wi-guan-hyul, which helps drive out coldness that has come from outside the body, and the hap-gok-hyul, which enhances the traffic of all the meridians.
Together with acupuncture, another good form of treatment is Moxibustion. It is widely used for its warming and disinfectant effects. As with acupuncture, the points where Moxibustion are applied vary according to each patient. First, the spot below the navel, namely the Kwanwon-hyul, Ki-hye-hyul, and Jungmun-hyul, are cauterized. In the leg, the area where Moxibustion is applied is a 사문교훈, on the inside of the leg. For the prevention of cold hypersensitivity, preserving the body's warm energy and avoiding foods which can make the body cold are extremely important. Not only limited to cold beer and frozen sweets, pork, many foods made from flour, and fruits such as watermelon can chill the body. For prevention, Oriental medical teas, together with herbal remedies, should be used. Like other women's diseases, medicinal therapy cannot be left out in the treatment of cold hypersensitivity. This medicine is drunk after being boiled down in a brewing pot with herbs that are good for patients with cold hypersensitivity.
Samultang, made up of dangui, which replenishes blood and enhances blood circulation, chungung, bekjak yak, and suk ji huang is the basic prescription. To this we add the famous Korean herb ginseng and gamcho, which never fails to appear on the list of ingredients. We also add herbs that replenish ghee, such as bekbogyang and bakchu. And finally, we add herbs that replenish the ghee and facilitate the secretion of sexual hormones, such as gugija, yukjongyong, paguk, and duchung. This prescription is boiled down and taken on a long-term basis and is effective in treating the cold hypersensitivity.
Another good method for the treatment of cold hypersensitivity is aquapressure therapy, using the Aqua point. This therapy warms the body and is good for blood circulation. The water massages every corner of the patient who has gone into the machine and also warms cold parts of the body. The pressure and temperature of the water is controlled according to the patient's condition, and so this is a more scientific method than the traditional massage method.
예, 처음에는 허리서부터 쭉 아파갖고요. 잘 걸을 수가 없었거든요. 근데 한 달쯤 됐는데 지금은요, 다리 아래만 저릿저릿하고 차도가 많이 있어요.
The more cold winds blow, the more occurrences of cold hypersensitivity increases. The causes of hypersensitivity to cold have also been shown to cause infertility in women. Moreover, it is not only women who are affected by the cold, but more and more men are affected also. Male hypersensitivity usually occurs below the waist in the knee joints. So, when the weather is chilly, it's important to keep your body warm.